Hi, my name is David Phillips. This is my nursing 612 head, ears, eyes, nose, and throat advanced health assessment for Maryville University. I have a 49-year-old female patient, Gina, Caucasian. Thank you for allowing me to do my assessment on you. One of the things we'll be looking at is the eyes and the ears, and the test. The first one will be the Snellen test at 10 feet. If you can read line number 7 for me, please.
TOZLPED.
And that is 2032. That's an acceptable range. This patient does have glasses on in the video. She does need corrective lenses, but for our purposes, that would be appropriate. Now, the next is we're going to hold about 14 to 15 inches away. It's the Rosenbaum near vision assessment. If you can read line number 7.
374254.
And that is also an acceptable test. Now we're going to come in. One of the first things you want to do assessing the patient is looking for symmetry, palpating your patient, looking for any lumps or bumps or contusions, abrasions, deformities, looking for symmetrical of the ears, the auricles, neck is midline, the eyes are in place with the nose. Then we're going to do the confrontation test. And you face the patient, you're going to cover your right eye. I'm going to cover my left. You'll let me know when you see my fingers.
Yes.
And we're looking for peripheral. Yes. Okay.
Yes.
All right.
Yes.
Okay, we're going to change our eyes, looking at each other's nose.
Yes.
Okay, as long as there's similarity, that's appropriate. The next test will be the cover test. And this is for the extraocular muscles, and you're going to have the patient fixate on a spot on the back of the wall, and you'll cover your left eye. Okay, and move that away. Okay, we're looking for movements, we're looking for any drifting, and she does not have any. If you'll cover your right eye, please, and we'll move that away. Again, there's no drifting, the gaze, and it's appropriate. We're going to use our ophthalmoscopic inspection, or fundoscopy, with the light. One of the things you want to do is just approach the eye. I'm just going to shine a bright light momentarily in your pupils. Her irises are green hazel. Her pupils are equal and reactive, 4 to 3, perla in both eyes. Both are moist. When you look at a patient's eyes, you can come in opposite eye, left to left, with my left hand. I'm going to come in, lenses are clear. I'm looking at the red reflex is present, it's orangish yellow. Blood vessels are present. And when you start to get in there, you can see that there's anterior chamber depth and there's macular abnormalities. I'm going to do the same on the opposite eye, coming in at an angle. Opposite eye, opposite hand. Red reflex, again, yellow-orange. Arteries veins present, no macular abnormalities noted. Now you can assess the eyes also at the same time. Eyebrows are intact. Coming back to the tympanic area, equal. If you have the patient close their eyes, there's no deformities, no abnormalities, no lesions noted. Eyelashes are full, intact, all coming away from the eyes. I'm going to pull down and look in at your conjunctiva. Bilaterally pink and moist. Sclera is white. I'm going to lift up your left eye. Okay. And I'll lift up in your right eye. All right. Again, we're looking for any abnormalities. The vessels are in place and equal. The lacrimal ducts are patent. There's no exudate noted. And we will then go with the assessment of the patient's nose and bridge, and we're going to feel maxillary sinuses. Any pain or tenderness noted? No. Okay. We are going to use our funnelscope, and I'm going to look in her left ear, looking at her tympanic membranes through the auditory canal. Her auricles are pink and warm. There's no lesions noted, no external secretions. When you approach, be careful respecting the patient, going to be a little back and up, and you're looking through the auditory canal. You can see the cilia. The tympanic membrane is gray. There's bony prominence, no deformities, no perforation noted. No cerumen present, and the same for the opposite ear. Switching hands, visualizing gray tympanic, bony prominence, no perforations, no bulges, no redness noted in the auditory canal. One of the things we've come in is we're going to look at the nasal passage. We're going to have her tilt her head up just a little bit. We're going to look at her nasal turbinates. Cilia present, red, pink mucosa, no nasal drainage, no polyps noted. No polyps noted, hair present, terminates in place. I'm going to set that down here for a second. On the auditory, a couple exams we want to do is the Weber test, and that helps to define hearing in the ears. I'm going to place this on the top of your head, and you'll let me know if you can hear it in one ear, both ears, in. Okay. The next auditory test is going to be the Rooney test, and we're going to place it for air to bone conduction, and I'm going to place it on the bony prominence behind the ear. Let me know when you don't hear it. And you hold it about 5 centimeters away from the patient's ear. Okay. We'll repeat it. Okay, a 2-to-1 time difference is appropriate. There's no abnormalities warranting further following. One of the last things we want to do is what's called the whisper test. And if you can cover your right ear at 5 feet away, I'm going to say a 2-syllable word. And you cover your left ear. Okay, so no abnormalities with the whisper test. She was able to repeat in both. When assessing the mouth, you can come in and basically with your pen light, I'm going to look and can you smile? Show me your teeth. Can you stick out your tongue? Looking for cranial nerves. 12 teeth are present and intact. If you can open your mouth real wide and stick out your tongue. And I'm going to grab and look. Okay, macula, lift up your tongue. You're looking for any kind of abnormalities, any lesions. Did not see anything there. You can use your tongue depressor. And there's buccal mucosa on the sides. I'm just going to pull away a little bit, looking for secretion. Okay, they're pink, moist. All right, teeth are in place. And if you can stick out your tongue, just going to visualize it first. Your uvula is a midline, it does lift up. Your tonsils, I'm going to stick out your tongue and say ah. Okay, tonsils are a 0. They're pink moist, there's no abnormalities, no swelling or redness noted. So, I just wanted to go over, this was my assessment for the head, ears, eyes, and nose and throat. Patient had a normal response and evaluation. Thank you.